Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again and live your life to the fullest. Today's topic is all about IBS, or Irritable Bowel Syndrome. I'm so very excited about today's show because my special guest is Suzanne Perazzini. Let me tell you a little bit about her. Suzanne is a certified nutritional therapist, a qualified teacher, award-winning author, including 3 low FODMAP books, and has been a teacher and a coach her whole life. After having her life transformed by the low FODMAP diet and a bunch of changes she made to her lifestyle, she now dedicates her days to coaching others on how to implement the low FODMAP diet and eliminate their IBS symptoms once and for all. She lives in New Zealand with her husband in a house overlooking the Pacific Ocean. Suzanne, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
Thank you so much for inviting me to be a part of it.
So Suzanne, I think a good place to start with this topic is how common is IBS? What are the symptoms? How do they assess for IBS or test for it?
Okay, so IBS is pretty prevalent actually. It's 10 to 15% worldwide, and they think it's more like 20% in the Western world have IBS. Now the symptoms are typically bowel movements which are not considered normal. Either you are on the side of diarrhea or on the side of constipation, or you could have the mixed type, which means you swing between the two. Now other symptoms are bloating. That's practically common to everybody. Bloating, a feeling of excess gas, maybe pain, some cramping. So difficulty after eating. And that can, of course, last for quite a long period once you've eaten the wrong food. What was the last part of the question?
I know assessing for IBS, it's really
yes.
a checklist of, it's called the Rome 3 criteria.
Yes, that's right. But basically, IBS is diagnosed, it's a diagnosis of exclusion. Once they've tested for everything else, like for IBDs, inflammatory bowel diseases like Crohn's or colitis, etc., and they can't find anything because with IBS there is nothing physiologically wrong. They can't see anything. So once they've excluded everything else with blood tests, stool tests, colonoscopies, etc., but your symptoms continue, then they normally give a diagnosis of IBS.
And can you speak a little bit about the hydrogen breath test?
Yes, the hydrogen breath test used to be a great way to see if you were reacting to some of the FODMAP groups. They can only test for lactose, fructose, and sorbitol. They don't test for the other groups. So you don't get a complete picture from it anyway. But unfortunately, recently there was research done on the fructose part of the test that shows that it's not a valid way to test for malabsorption of fructose, because they did it, basically the test was testing the same group of people on the same diet over 2 weeks, and the results of the first test were different to the results of the second test. So they now say it's not a valid test. And it's also a fairly expensive test, and it takes a lot of time. I had it done about 5-6 years ago, and you have to do it over 3 days for about 3 hours at a time. So it is a chunk of time out of your day, especially if you're working. And it doesn't give you the complete information anyway. You still have to do the low FODMAP diet to find out about the other groups. So you might as well do the diet straight off.
And actually the hydrogen breath test that I was thinking of was using lactulose or glucose to assess for methane gas and hydrogen gas.
Exactly. Yes, they do the control testers with lactulose to see if you breathe the methane or the hydrogen. The hydrogen's more associated with diarrhea, while the methane's with the constipation. So that's your first test for 3 hours, while you breathe into a bag every 15 minutes and they capture your breath. And the second one usually is the fructose. On about a week afterwards you do that one, and you do the same thing. You take this very sweet drink, and then you are tested every 15 minutes up to 3 hours for that. And then a week later they do the lactose test. And if you're in certain countries, they also test for sorbitol. They didn't do that in New Zealand, but I know in the US they do.
So Suzanne, I wanted to ask you about your journey. What's your journey been like as a lifelong IBS sufferer?
Well, as you mentioned, I've had it all my life. I always knew as a child that there was something different, because my sisters could run into the toilet and be done in a couple of minutes and come running out. Whereas because I've got IBS on the side of constipation, it would take me much longer in the toilet. But I didn't really think too much about it. I mean, nobody said that much about me being different. But as I grew older, it made life more difficult in the choices that I made. I tried to not let it control me. I still traveled a lot. I did what I wanted to do. But about 10 years ago, my father died, and the stress of that situation kicked it up a notch. And it got to a point where it really wasn't that bearable. So I did a lot of research into it. And as the internet kind of caught up with what I needed, I started to learn about the low FODMAP diet. And at first I completely ignored it because it was so complicated. I mean, who could do a diet like that? So for about a year, I suppose, I ignored it. And then one day I decided I just had to look a little bit closer into this. And my golly gosh, they were talking about all my symptoms and how it could help with them. So that's when I did the hydrogen breath test. I actually rang up my doctor and asked about it and got a nurse, and the nurse had no clue what I was talking about. But she was a curious soul, so she did some research for me and got back to me. And surprisingly enough, the only place at that time that was doing the hydrogen breath test in New Zealand was about a kilometre down the road from where I worked. So I did the test. And when I did the fructose test and took that full glass of sweet liquid, I was really sick. And they actually had to put me in the recovery room at the clinic. And so I didn't really need to be breathing into a bag. That kind of told me anyway that that was one of my triggers, and it is one of my major triggers. But then I started the diet, and as I say, it was complicated, so it took a lot of time to kind of figure out how it worked, because there was no real talk about the amounts and the combinations of foods back then. And so I was obviously overeating, even though I was eating the correct foods. So over a period of about a year, I suppose, I refined it. I started to work out about the other gut irritants like fiber and fat, which have to be taken into account. And I just started to feel so much better for really the first time in my life. And at the time, just coincidentally, I had a food blog about cooking. So I switched that over to being about IBS and the low FODMAP diet. And it just took off. People were really drawn to my website, and it sort of became bigger by the day. And then at a certain point, I thought, look, there's nobody helping these poor people out there, because I would get 10, 20 emails a day asking me for help because they had IBS, and could they try the diet? What did they have to do? And I was working full time and just didn't have the time to help everybody. So I made the dramatic decision to leave work and to set up as a coach for these people. And that's what I did, and it just took off from day one. I decided to do a group program. It filled up almost immediately, and I've never stopped since, and that was about 4 years ago.
So as you were saying, IBS really is a diagnosis of exclusion that normally your health professional will run many different tests to make sure you don't have a more serious condition going on, like ulcerative colitis or celiac or Crohn's or something else. And the majority of the time, well, all of these tests come back normal, and then that's usually when the patient is given the label of IBS. And most patients now are quite internet savvy, as you know, Suzanne, and they're like, okay, IBS is a label. It still doesn't tell me what's wrong with me. And a lot of patients are also just very confused about what they should eat. They kind of fall into two categories. One category being they just don't even know where to start, and the other category being they've tried many different diets and just have not felt any improvement. So maybe the next good place for us to journey into is the low FODMAP diet. So first off, what does FODMAP stand for?
Yeah, FODMAP's an acronym. So the F is for fermentable, O is for oligosaccharides, which include things like onions and garlic and wheat. And the D is disaccharides, which is lactose and dairy. M is monosaccharides, which is the fructose in excess of glucose. A is and P is the polyols, which are the sugar alcohols, sorbitol and mannitol. And they're all carbohydrates, or sugars, because carbohydrates break down into sugars. So the diet's made up of 3 macronutrients: fat, protein, carbohydrate. We are looking at the carbohydrates in our food.
And so really it's trying to assess the carbohydrates that kind of fall into this categories as being high in FODMAPs and trying to avoid them. But you had also said another thing, which I think a lot of people don't realize, is sometimes a food can be okay in a very low amount, maybe 1/4 cup, but if you increase it to 1/2 cup, then it becomes disruptive to the body, and that can be really tricky for people to figure out.
That's right. A lot of people these days are given a list of foods to eat and those to avoid by their health practitioners, but that's just the beginning of the story. We must have the amounts beside those foods, because all fruits, all vegetables, grains, legumes, pulses, they all contain carbohydrates. So we can't cut them out of our diet like you could if you went gluten-free or lactose-free. Those are fairly simple things to figure out. So we can't cut them all out. So we have to choose which foods, which are the low FODMAP foods, as chosen through research by the Monash University in Australia, and avoid the high FODMAP foods. But as you mentioned, we can have 1/2 cup of zucchini, but if you have a full cup of zucchini, you've actually pushed it into the high FODMAP territory. So the question of amounts of each food, and also combinations together in the same meal of the same FODMAPs, is a super important factor. And that's why so many people fail if they try to do the low FODMAP diet without guidance, because they just have this list, and so they sit there and they eat 3 carrots, or they eat a full cup of sweet potato and wonder why they've got a bellyache when they're being good and following the list.
Yeah, I guess the other thing that I can piggyback on top of that is even that 1/4 cup of zucchini for the majority of people will be totally fine, but there are the outliers, those few people who even that 1/4 cup is too much for them, right?
That can be the case, because this line that the Monash University has drawn across and said low FODMAP below and high FODMAP above is an average. And who of us is average? But we have to start somewhere, and so that's where we start. So with my clients, I put them on a really clean elimination diet using only low FODMAP foods in the correct amounts, in the correct combinations, and then I look to see if there are still symptoms. And if there are still symptoms, we have to look at other things like, let's call them personal idiosyncrasies, things that affect them that mightn't affect anybody else. And it mightn't even have anything to do with FODMAPs. It could be eggs. It could be the salicylates in nuts, the oxalic acid in spinach. So we're looking for those things. And we're also looking, as you said, for those tolerance levels, because fructose is one of my major triggers. Even though we can have a full banana, I would only eat half a banana. We can have 20 blueberries, I would have 10. And that's because I know that that's still a bit high for me, for that particular FODMAP. Whereas, for example, lactose, I don't react to it at all. So I can have any of that I want to. So at the end of the day, we are all individuals, but we need somewhere to start. So we start with those low FODMAP foods.
And as you were saying, even people that are doing the correct low FODMAP diet, if they're not seeing results, if they're not seeing good results, it's really about digging deeper into the case, that they could still have an underlying issue with oxalates, with salicylates, with histamine, with sulfur. It's hard to do all on your own. That's where having a really good coach comes in.
That's exactly right. Now, the majority of my clients don't have any of those other issues. Probably still about 20%. We will find something else that they react to, but less than you would think. I mean, even having a reaction to the casein in milk, the protein part, as opposed to lactose, the carbohydrate part, I've only, out of hundreds and hundreds and hundreds of clients, had a small percentage have a problem with casein. It is less than you think. But we do have to take that into account, that that's a possibility, that the individual who's trying it by themselves is not finding those things. That's where a good daily diary comes into play. But also the first thing to look at is, are they doing that low FODMAP diet 100% accurately? Because even one wrong food and you'll have symptoms. I always remember a client of mine, a farmer in England, who was doing brilliantly on the diet. He was so excited that he'd got his life back. And we started the testing. And the first test we did was honey for fructose. He had a teaspoon of honey and could hardly move all day because, like with me, it was one of his major triggers. One wrong food in a perfectly clean diet and he was sick all day. So you can't make one mistake. This is not a diet that you dabble in and think, okay, I'll take this out and that out and see how I go, and then we'll try this. You do have to start from the standpoint of an elimination diet, everything out, and then you start to build to create your own personal diet. But that's the first thing you look at if the diet seems to be not working. Am I doing this accurately? If you're not sure, go and get some help.
And Suzanne, it's good that you just happened to mention the honey, because I know there's, depending on where you source the honey, that there can be different concentrations of fructose related in relation to glucose, and that can trigger symptoms. So maybe some people will do much better on clover honey than a different kind of honey. It's tricky.
It is tricky with honey. Most honey has fructose at a higher percentage than glucose, and that's where the issue is. It's that excess fructose that doesn't get absorbed and goes down into the bowel and ferments. Clover honey in particular is one where the percentage is pretty much even and you might get away with it. The majority of the other ones are not great. But a good fructose one to test with actually is mango, which we know is high in fructose, and it has no other FODMAPs in it at all. So we are doing a pure test for fructose with that. So the foods that you choose for your testing are quite crucial as well.
Suzanne, what are your most favorite resources that you use or can recommend, websites, etc., for people that are out there that are looking for accurate information on these foods that are considered low FODMAP or high FODMAP or in between moderate?
Well, obviously we use the Monash University because that's where the diet was created, where the major research is still continuing today into the FODMAP content of different foods. and they have their Monash University phone app, which is absolutely crucial to have. They also have a little booklet that you can purchase for around about 10 Australian dollars. And that's really useful in that it has the foods in graph form, so you can see what FODMAPs are in each food, all kind of laid out in a graph. So definitely the Monash University, and they have a blog. There are two other dietitians in the US who have been doing this for a long time and who specialize in the low FODMAP diet, and they, of course, are perfect sources of information, and that's Kate Scarlata and Patsy Katsos. I'm not sure if I'm saying her name right, but it's Katsos. And those are the three sites that I would recommend and that I rely on.
So then I guess the next question that I have, I'm kind of going inside the listener's head, and what would the listener want to know? Okay, how do people lead a normal social life that have IBS and need to follow the low FODMAP diet? What do you recommend?
Right, well, I lead a normal social life, and I travel a lot as well. So you do have to put strategies in place. We can't pretend that we are normal. We have IBS. There's no cure for it, but if we stay on an accurate low FODMAP diet, the one that we've expanded and created for ourselves, then we can live a pretty normal life. And the fact that you're living without symptoms is an enormous incentive to stay on it. But there are certain things I put into place. For example, if I'm going to be going out to a restaurant, I do a little bit of homework. I look it up online, I look at the menu, I choose 3 or 4 things that I think are likely to be possible that don't have the words like garlic in them, and then I bring up the restaurant and I ask to talk to the chef. Don't talk to anybody else, they won't know. Talk to the chef and just have a discussion around those choices that you've made and see what he recommends. Often they will say, don't worry about it. When you get to the restaurant, I'll come out and talk to you and we'll sort something for you. I have never yet had anybody turn me down with that. And I've never had trouble in a restaurant either. Now, when I travel, I take a laminated card with me, just a small postcard size, and I put on it in the language of the country, my major triggers. So it depends what yours are. For me, I put no garlic, no onions. There are 4 things that can be hidden in food. The wheat, dairy, so the lactose, wheat and onions. Often you don't see them on the plate. Everything else basically you see on the plate and can avoid, or you see it written on the menu. So you would, if you have a problem with all of those, and I hope you wouldn't once you've done the testing, you'd put lactose-free, onion-free, garlic-free, and put gluten-free, even though that's not accurate for us. It's what the public understand, because gluten is the protein part of wheat, and our problem is the fructans, the carbohydrate part of wheat. But if you put fructan-free, nobody will know what you're talking about. So put those 4 things. But if you found, like me, that I have no problem with lactose, leave that off. And for the wheat, I can have a kind of a half a serving, so I don't put that on my list. We don't want to confuse people. So I go around the world with a card that says lactose-free and, onion-free and garlic-free in all the countries, languages that I go to, and that works well. You get a few giggles, but at least you stay safe.
And besides talking to the chef and traveling with your card in other languages, which I think are brilliant, do you have any other recommendations or tips for people that are frequent travelers?
With traveling on the aeroplane, for example, I don't suggest necessarily asking for a gluten-free meal, because that'll just mean that possibly the bread is gluten-free. That doesn't mean it's low FODMAP necessarily. Remember that gluten-free does not equate low FODMAP at all. In fact, gluten-free foods can contain high FODMAP ingredients like the soya flours, almond meal, coconut flour, those things, which are all high FODMAP. If you're traveling with somebody in particular, what I do is that my husband and I, because there's normally 2 choices, choose a different one each. I eat off the plates, what I can, and he eats the rest. I also always take low FODMAP snack bars with me wherever I go. I'm about to, September, go on a trip through China, Mongolia, and Russia. And I'm collecting my low FODMAP bars, so I'll have one, at least one for each day that I'm away. And while I'm at it, I will just mention the FODY snack bars, FODY. They sent me a great big pack of them, which is fantastic, and I really enjoy them. That's the important thing. But there are other people out there now who are doing the low FODMAP snack bars, but do stick to those who are doing low FODMAP. Don't go for gluten-free, as I mentioned. That might not be low FODMAP. So take your snacks with you. When I stay in hotels, when I'm traveling, I go to the breakfast bar, which is normally like a buffet, and there's always something there you can have that's low FODMAP. And just scrambled eggs, there'll be some fruit that you can eat, etc. But there's also what I do is I take little squares of tin foil from New Zealand when I travel, and I take one of those in my bag for each breakfast, and I put something in there that I can eat for my morning snack from the breakfast bar, and I wrap it up in tin foil and put it in my handbag. So that takes care of my morning snack. And then I'll have a snack bar for my afternoon snack. Normally lunch and dinner are in a cafe or a restaurant, and that's where I utilize the same strategies that I mentioned before.
Suzanne, so let's switch gears and think about the long-term plan for patients with IBS. So with the clients that you've worked with, do they all have to be on the low FODMAP? FODMAP diet forever? Do certain patients, are they able to have more wiggle room on the low FODMAP diet?
All right, so you start with the elimination diet, and nobody stays on that, and we shouldn't stay on that. Unfortunately, a lot of people do seem to, because they don't understand that on the elimination diet, you've taken out a lot of the prebiotics from the diet, and the prebiotics are what balance the gut bacteria. So you might start to feel better on the elimination diet if you're doing it accurately, but if you stay on it too long, you could reverse that as the gut bacteria get out of whack. So the Monash University advises us not to stay on it for longer than 6 weeks. So with my clients, I keep them on it for about 3 weeks to get them symptom-free. Then we launch into the reintroduction stage, which is when you're testing food groups and foods to see what your major triggers are, minor triggers, and what doesn't trigger at all. I've never yet had a client who has a problem with all of the FODMAP groups. So we're able to add foods and whole groups back in again to create a much more expanded diet. And that will create a final diet which is different for each person. And that's your diet for life. That's what you've got to stay on. There's not enough research or enough time since we discovered the diet for there to be any information about whether over time that could change. There's no harm every 6 months in maybe retesting foods if you want to see if anything changes or not. But we have IBS for life. And what we malabsorb is possibly now for life. But certainly, every 6 months if you want, retest and see if something has changed. And eventually, of course, there'll be enough information for the Monash University or any other research center to be able to advise us on that.
Suzanne, we've spoken about many things today, and this is a big topic to try and cover in one podcast. So in the few minutes that remain, I wanted to ask you if there's anything else that you think is important for our listeners to know about this subject.
The only other thing that we haven't mentioned is that the low FODMAP diet is the base that you need for sorting your IBS symptoms, but it's not everything. We do need to look at other gut irritants, obvious ones like alcohol and caffeine, but also fiber and fat are gut irritants for those of us with IBS, and we can't cut them out. They're essential to the diet, but we all have our own fine line with them. If we tip over that line, we'll get symptoms. So we have to push up against the line to get as much fiber and fat as we can tolerate without tipping over, and that will be individual for everybody. Especially if you've got IBS with constipation, you must get those levels right, or you will continue with the constipation. People with IBS with diarrhea get results really quickly on the low FODMAP diet. Within a few days, their symptoms can be gone. With constipation, it's like you have to almost layer a diet on top of it, in which you're gradually increasing your fiber to get to the right level to create really consistent stools that on the Bristol stool chart are around a number 3 or a 4. So you've got to work that over about 2 weeks it would take to build your fiber levels to get there. So we must not forget those other gut irritants. And the other aspect is lifestyle. We know that we have a faulty brain to gut connection, and that we have a hypersensitive gut, and it overreacts to everything, not just the food that's put in it, but also to stress, lack of sleep, lack of exercise. So you have to focus also on that whole lifestyle thing. There's many puzzle pieces that come together to get you symptom-free, and the FODMAP diet is the foundation piece, but there are other things you have to look at.
Suzanne, how do you and your website help people with IBS, and where can our audience find out more information about all of this?
So my website is strandsofmylife.com, and it has hundreds of low FODMAP recipes, articles, videos on IBS and the low FODMAP diet, and that's all completely free information there for anybody. I also have a coaching service, a one-to-one 6-week program. I have a self-study program for those who want to do it by themselves. And I also have a customized meal plan service where I create a week's worth of meal plans based on a questionnaire that's filled out. But today I'd like to give your listeners a gift of an accurate, up-to-date food chart for the low FODMAP diet with the amounts. And if they go to www.strandsofmylife.com/Carri, C-A-R-R-I, for a wonderful hostess, then they will be able to download a free food chart.
That's fantastic, Suzanne. Thank you so for being so generous with that. And for the listeners out there, I'll make sure to put all of those links in the podcast show notes on our website, so that you can easily access information about this, and you can easily find Suzanne. Suzanne, thank you so much for being my special guest today. This has been an awesome interview.
Thank you so much, Dr. Carri. It's been lovely to be able to talk to you, and I hope that's been helpful for your listeners.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Suzanne Perazzini. And I want to thank you, our listeners, for tuning in today. And I'd like to invite you back next time for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.